Hello, everybody. You're back with Sativah Sistahs Sessions. I am your host, Nikki D. And today, with me, I have a very distinguished guest, the obstetrician, gynecologist, cannabis advocate extraordinaire, Dr. Felecia Dawson. Thank you very much for joining me here today.
Thank you for having me.
It's an honor. Thank you. For those who are not familiar with Dr. Dawson, she received her medical degree from Morehouse School of Medicine. She has over 30 years of experience in women's healthcare. She is acknowledged by Essence Magazine as one of the leading Black female obstetrician gynecologists in the nation. She is the first physician in Georgia to join the Society of Cannabis Clinicians. And to that end, you're a cannabis advocate, educator, and consultant. Thank you for being here. I hope we can get into some really cool, enlightening stuff today for our audience. All right, first question. You believe that we have a great deal of power over our health. You're certified in holistic and in integrative medicine. Can you expand on integrative medicine for anyone who may be unfamiliar with the term? Because I know I wasn't familiar with it.
Integrative pretty much means holistic,
Okay.
and it looks at the entire person, body, mind, and spirit. Typically in conventional medicine, we are looking at suppressing symptoms more so than trying to get to the cause of the symptoms. In holistic, integrative, functional medicine, all of that, we're trying to get to the cause of the disease. And I love this cartoon that shows two physicians mopping water on the floor, trying to get the water up on the floor. But when you look at the sink that the water is coming from, the faucets are on full blast and the sink is overflowing. And instead of them cutting off the faucet, they're trying to mop up the floor. So that's kind of the difference between conventional medicine and holistic integrative medicine. You look at the person's environment, their nutrition, their sleep, the work that they do they have any support? Is there any type of spirituality? All these things impact your health. Events that have happened in your life can also affect your health. I like to say that your biography becomes your biology. And a lot of times people don't truly heal from things that have happened to them. And it's not so much what happens to you, it's how you heal and move on from those things. But some people carry their wounds with them throughout their life, and it can manifest as disease, emotional as well as physical disease.
Wow.
So integrative holistic medicine looks at all those things, looks at, botanicals, meditation, yoga, all these other type of pathways to healing.
Wow, that's amazing. It reminds me of a story that one of my friends, he's one of my older friends, known him for a long time, and he was going to the doctor for a rash that popped up on his skin, and he said they just kept giving him creams and like just these funky things to put all over his body, and it was just spreading. It wasn't ever getting better. So it was just like kind of treating, not even really treating, the symptoms that had come up on his skin. And then he decided to go to a holistic doctor, and that doctor was telling him that his kidney was overworking, and it was all kind of coming out through his skin, and it was because he had kidney surgery to give a kidney to his cousin. And it's like his primary doctor, it didn't even occur to him to consider anything like that. And it was this holistic doctor that told him, and then they treated that from a holistic standpoint, and it just receded. And he just talks about the trauma of having that appear all over his skin and never, just being frustrated by the whole process and feeling like the doctors weren't listening, weren't making any headway and all of that. And to find out later that it was something that almost seemed kind of obvious to kind of, look at and start with. You knew his medical history, which his primary doctor would have. It was just an extremely frustrating situation for him all around. And so I wasn't familiar with holistic healthcare before that story, and then when he was telling me about that, I became a believer in it. So I really respect that. That area of medicine is awesome.
And I'm a real big believer in mind-body medicine as well, that sometimes our emotions and thoughts, as I was saying, can manifest as disease. I remember having a patient come to me saying that she had this right breast pain. And we did a mammogram. Her exam was normal, and I was like saying, so when did this begin? And so that's why history is so important.
Mm-hmm.
And she was talking about the dynamics between she and her brother and her mother, and something recently had happened with her brother, and she said, my mom always loved him more than me, and that kind of thing. And metaphysically speaking, there's a woman named Louise Hay, and she kind of maps out parts of your body, and whatever's going on with that what part of your body, it tends to most of the time have to do with certain things. So with the right side of the body, it tends to deal with the man, the male, the father.
Interesting.
The breast is about forgiveness, heartbreak, those kind of things. And so I said, perhaps you are feeling something about your brother, and that's why you're having this breast pain. And probably once you come to some resolution with that, the pain will probably go away. And it did. And she was like, yeah.
Wow.
Yeah. So it's interesting how the mind and the body interact with each other.
It really is. It kind of reminds me of something I recently read. I got to read more up on it, but it was saying about Black people having inherited trauma and generational trauma, and how that can affect our health. And then I think about the term weathering, and how all these little microaggressions and major aggressions, micro and macro aggressions that we have to deal with, and how that ultimately adds stress and everything like that. So I think it's an extremely fascinating area of medicine that I think we just, culturally speaking, should get closer to and get more. I feel like, and I don't know this for sure, that it's closer to indigenous medicine approach.
Yes.
Which us being from indigenous people before being brought over here, it would be beneficial.
Yes,
to
I
us.
agree.
Next question. A couple of years ago, you closed your medical practice to focus on advocating, educating, and consulting on medical cannabis full-time. What led you to take that step and decide to get involved with cannabis specifically?
Before I closed my practice, I had started hearing about cannabis like 2-3 years before I closed my practice, and learning about the medicinal benefits, learning about the opportunity for criminal justice reform, learning about the economic benefits it can have for those who were disenfranchised and penalized and imprisoned and all those things. It just was very fascinating. And so I just started reading about it. And at the same time, the business of medicine was becoming more and more heavy on me. Trouble sleeping, stressed all the time, trying to run a business, trying to make payroll, trying to pay your bills, watching your reimbursement from the insurance companies decline as the overhead continues to increase. The electronic medical records, and government regulations, it just was making things very unpleasant. And I just had enough. And although I love teaching people how to be healthy, I love helping to empower people with their health, I said, I can't do this like this anymore. So I closed my practice and devoted 100% of my time to learning as much as I could about medical cannabis and trying to get the laws changed.
Yeah, I imagine that was nowhere near an easy or simple decision to do anything like that. Or maybe it was, if you're approaching it from a holistic standpoint, which that's what I'm kind of getting.
Well, I have been thinking about it for a couple of years, just to walk away. I have been thinking about it for a while, actually. And I just decided to do it. I said, I can't go into another new year with all of this heaviness on me.
I guess when you know. So I know Black women tend to make careful movements when it comes to major changes in that way. When you were deciding to do this, with the state of cannabis legalization being so different in the various states and in the nation and all of that, did you have any doubts about ending your practice to focus on that full time? And if you did, how did you overcome them?
I am probably a entrepreneur by default, a reluctant entrepreneur. It wasn't that difficult. I mean, if I'm passionate about something, and I am about cannabis, it propels me, and I don't. Occasionally now, as I'm spending my retirement money, occasionally I'm brought back to reality. Think, okay, you really need to start working. However, that's the only thing that really distracts me. If I really enjoy what I'm doing and I really enjoy learning about it, I enjoy talking about it, I enjoy teaching people about it, it gives me much pleasure, and it kind of overrides everything else.
Oh, okay, cool. So you're certified in medical cannabis. Can you talk about how that fits into your knowledge and practice of holistic and integrative medicine? How does that all come together?
To me, it's just like another tool in the toolbox of a healer. As I was saying, meditation, nutrition, sleep, stress management, relationships, doing work that you love. It's just like another tool in the toolbox. Mm-hmm. And it's beneficial because it can replace multiple medications. I'm extremely excited about it for our seniors, mm-hmm. because they're oftentimes on 5, 10, 15 medications. Yep. And cannabis can replace, on average, at least 5 medications. Wow. So I am very excited about that possibility.
Mm-hmm. Yeah, I read that they are the fastest growing demographic, I believe, mm-hmm. to start using mm-hmm. cannabis, which is awesome because I think they've lived with, prohibition longest and had some of the more harmful, like I'm from the DARE generation, where we had that in our schools, say no to drugs and, mm-hmm. and all of that. And it's been difficult enough, just trying to talk to my friends who are my age, about how cannabis might help them with some of the things that they're dealing with, like rheumatoid arthritis and MS and stuff like that. And these are my friends, so I can't imagine how the decision might be for them. And some of them might have been doing it back in Woodstock days or something. I mm-hmm. just gotta imagine that. But others probably had harsher messages than we had growing up. And I think that's amazing that they're opening their minds up like that. Mm-hmm. Can you talk about the endocannabinoid system? What is it? How does it work?
Well, scientists were studying the cannabis plant, trying to figure out how and why it works. And they stumbled upon this system that's contained within our bodies. Every mammal has an endocannabinoid system. It's a system that actually governs your neurological systems, your hormonal systems. It is made up of endocannabinoids, which are similar to the CBD and THC in the cannabis plant, except that they're not as strong, and we make them. There's a baseline of one of these endocannabinoids called anandamide, but when we are stressed or ill or hurt, our endocannabinoid system kicks up production of these endocannabinoids. So there are receptors all over our bodies, more than just 2, but the 2 main ones that we know about are CB1 and CB2, but there are multiple receptors in the endocannabinoid system. There are the cannabinoids or endocannabinoids, and there are the enzymes that create and break down those cannabinoids. Mm. They help to govern the release of the neurotransmitters or the little messengers between our nervous system. Mm-hmm. And an example of how it works is that, for example, if you were to, for whatever reason, suffer a stroke and an area of your brain is not getting blood, the endocannabinoid system would actually kick into action and try to limit the size of the damaged neurons. It would try to limit the release of a neurotransmitter called glutamate, which causes cell death. Mm. And it tries to keep that size of the injured tissue very small. So that's an example of the endocannabinoid system working to protect us. If we get hurt, endocannabinoid system starts producing the endocannabinoids to help us not experience pain as significantly as we would without it. It tries to interrupt pain from reaching our brain, as well as the site of injury, stopping the impulses from being so strong. So the endocannabinoid system helps us with everything from pain to digestion to movement to thinking, reproduction, experiencing pleasure. It really governs pretty much everything we do. And it's like the maestro conducting the symphony in our bodies.
That I can't imagine as a medical professional how exciting that would have been to have that discovery, come out and all that. I think it's fascinating. Do we stop producing endocannabinoids when we get older, or how does that?
Well, we always are producing a baseline. However, as we do get older, our endocannabinoid system doesn't work quite as well, and you can be deficient, especially women. It seems like the aging process affects our endocannabinoid system even more than men. So you can develop something called a clinical endocannabinoid deficiency, which is a thing, and that's what they think is pretty much behind all of these neurodegenerative diseases like Alzheimer's and Parkinson's, autism, cancer, autoimmune disorders like lupus and rheumatoid arthritis, seizures, migraines, a lot of things they think are due to the endocannabinoid deficiency.
Wow. And so if we were to derive them then from cannabis, I don't even know if hemp works the same as just standard cannabis plants. But if we were to derive it from those plants, then maybe it would be like a supplement then?
Yes, exactly. So if your endocannabinoid system is not working at 100%, supplementing with a phytocannabinoid, because ours are called endocannabinoids because they're made inside of our body. Phytocannabinoids are the ones found in the cannabis plant and the hemp plant, and then they have the synthetic cannabinoids that the pharmaceutical companies have made.
Right.
And yes, supplementing with the phytocannabinoids can help get your endocannabinoid system up to speed.
Awesome.
And restore your health.
Okay, cool. And so CBD is like the big thing, right now, kind of I think driving a lot of what's going on right now. Everybody's kind of heard the term CBD, and why is that being pushed so hard? The way I kind of understand it may be a little bit limited of a knowledge, but THC is the part that gets you high, and CBD is the part that more deals with pain. But that just may be a really simplistic way of thinking about it. What does CBD in particular do with the endocannabinoid system?
Well, I'd like to back up just a little bit to say that THC does more than get you high or helps you to feel good. It does help with sleep. It helps with inflammation. It can be sedating, and it helps to fight cancer. Actually, there are some cancers that don't respond to just CBD. You actually need to have THC, almost a 1-to-1 ratio, and I mean a lot of it sometimes.
Wow.
Now, moving on to CBD. CBD is much more complex than THC. It doesn't bind the two most common cannabinoid receptors, CB1 and CB2, very strongly, barely at all, actually. CBD, so far, we've identified at least 65 metabolic pathways that it works through. CBD turns on approximately 700 genes that fight cancer. CBD turns off approximately 500 genes that cause cancer. So it's like it really works with your genetics as well. And it works with sets of about at least 5 or 6 different sets of receptors that help promote sedation. For example, it can help there's a neurotransmitter called GABA, and it is sedating and helps us to be less anxious. CBD helps GABA to bind to its receptors more efficiently, more strongly. So that's part of how CBD causes sedation. CBD also kind of prevents THC from binding to its receptors. And so therefore, if you don't want to feel as high, if you don't want to be anxious, because some THC can make some people feel anxious, paranoid, those kind of things, CBD can help counteract that particular aspect of THC. CBD helps with cancer. It helps break down amyloid plaques, which causes Alzheimer's. It's anti-inflammatory. Did I say cancer fights cancer? Okay, fights cancer.
That's key. You can say that multiple times.
I know.
Like
It's anti-inflammatory, so it's really good for autoimmune diseases. It does help with pain. It can help with sleep. On the other hand, some people feel more excited with CBD, but it can help. It depends on the person's sleep versus getting you more alert. But it works through multiple channels, multiple receptors, and it does many, many things. Also, cravings, I forgot. It can help decrease cravings, and it seems to be the only thing that does a reasonable job in helping people not, I'm missing the term, when they are on drugs and they relapse. It helps decrease relapse for drug abusers.
Wow. That's amazing.
Especially opioid users.
Really? Wow. With the crisis we have going on in this country, and the crisis of crack and heroin before that, I imagine that would be amazing, like an amazing breakthrough. And I wonder if drug treatment centers are looking at this, or do they have that? And not that you would know the answer, but just generally, I wonder if they would be looking at this as a way of fighting addiction of all these things.
I definitely know research is being looked at to use it to see how well it does. I'm not sure if it's actually made it to drug rehab centers yet, but they are definitely doing research on it right now.
Wow, that's very enlightening to me. I know I've heard people say, I need my THC, when the push is CBD and hemp with no THC and stuff like that. I know I've heard people, say, I need my THC, and I didn't understand enough, but I know that sounded like a little odd to me, like, why would you need, isn't CBD the thing that you need? But, so that's really educational for me.
Yes, I mean, the plant, when you're just taking out the CBD, that plant has multiple cannabinoids besides THC and CBD, and it has terpenes in it, which are plant chemicals that give cannabis its flavor and aroma that also affect our mood and are anti-inflammatory and can be, sedating, or it can help you stay alert, so you have more medicine in the plant versus just taking out one or two cannabinoids.
Yeah. Awesome. So, with your work as a medical cannabis advocate and educator, do you have a chance to see patients still? Does that involve medical cannabis treatment plans? Do you see patients really?
I don't see patients at the moment, but I am planning to start an online educational consultation service. I will not be writing prescriptions or recommendations for cannabis. I will not be writing prescriptions for medications, because I'm just basically just sharing education to people. And so I'm hoping to fill in the gaps and holes. If you have a physician who doesn't know much about cannabis or is not interested in knowing anything about cannabis, I can help guide you if you want to, use cannabis as part of your healthcare regimen. But as a holistic integrative physician, I'm going to also be, recommending lifestyle changes and dietary changes, and, seeing what else is making you ill,
Right.
So I don't want people to think that cannabis is a
miracle
panacea,
cure.
like that's all I gotta do is just do some
Right.
cannabis and I'm good. I don't have to change anything. But
Right.
It's really about trying to look at the whole picture.
Okay, cool. I know there's a study going on at Yale looking at how patients with sickle cell utilize cannabis, and I know sickle cell is unique to our community. One of the things that I know particularly affects the women in our community is fibroids. And you, with your background, I know you're well acquainted with fibroids. What are your thoughts on how cannabis might help with fibroids, if at all?
Well, I believe it can. I know there's not any formal present day research about it, but because cannabis is anti-inflammatory, because cannabis is a muscle relaxant and the uterus is a smooth muscle, theoretically I can see how it could help with the pain. And historically speaking, when you look at how cannabis has been used over the thousands and thousands of years with women and humans, heavy periods, painful periods were one of the two most common reasons that it was used. And I don't know that they knew about fibroids back then, but heavy periods, painful periods is probably the two most common reasons cannabis was used, and it was very effective. Wow. So I foresee that at some point, I mean, and that is one of my dreams besides educating people about cannabis, is to do some research in women's health care and see how cannabis can help with things like fibroids, endometriosis, menopause, trying to see what forms of it work better, what doses work better. That is something that I want to do, and I'm going to reach out to one of the local medical schools and see if they're even open to doing that. Because, like you said, Yale's got something going on. I'm aware that there's a Harvard researcher who's working with a company in California who makes a product called Foria, as I remember it. They make suppositories with just CBD or THC and CBD that go into the vagina to actually treat painful periods, endometriosis, those kind of things. So I'm hoping I can get a medical school in Georgia to help me, work with me to do some research, and maybe we can, partner with a company in a state that it's legal and be getting information while we wait on the federal government to re-legalize cannabis.
Right. And I know, there's a lot of changes, being talked about in Georgia, in particular, and allowing perhaps in-state growth, I guess it would be cannabis. I know hemp, now is nationwide legal, but we're still waiting on some regulations and stuff. So it'll be interesting to see how far Georgia goes in terms of allowing that. But then if our schools here, like Georgia Tech or something like that, get involved with programs to grow, if there's an avenue that way to grow and then do studies, it's certainly very interesting. I'll be watching that one. So next question is, what's the biggest misconception that you've had to address about medical cannabis use?
I think the main one would be that it's just about getting high. I think that's been the major misconception. And, even the people who are, quote unquote, getting high, don't always realize it, but they are medicating. They're trying to address symptoms. Yep. And they feel better when they do it. And it's not really just about getting high. Right. As I was telling someone else, I say, is a bad thing to feel good? I mean, why is that bad?
Right. And that's another thing, like I mentioned, with my friends about the symptoms they were talking about treating and all of that, is I think that a lot of people in our community don't realize that they are self-medicating when they're using it so much. It's just like, this pervasive idea of, I'm just, get blazed and all that stuff. Well, you probably got some things you're trying to deal with, and you're using cannabis to do it. And I think if we could get people to realize that, then they would start looking at it more for its medicinal value, and not just entertainment, which, I mean, it's awesome for entertainment too. I'm not saying there's anything wrong with that, but look at it more for its medical side too and start taking that seriously. So the endocannabinoid system has been known about for around 3 decades, yet not much more than 10% of medical schools teach their students about it. What do you think it would take to increase that percentage?
Well, getting legal on the federal level would help a whole lot, because sometimes institutions get a lot of their money from the federal government. So they don't want to step on anyone's toes or risk their funding. Yep. I think if residents and medical students start demanding that we need to know about this so we can better take care of our patients, I think it would help a lot as well. Because medical education has changed somewhat. I mean, since I left, they're now bringing more public health information to the physicians. They're also making sure they have a clue about interacting with patients, that they're not just scientific subjects, that they're people, and they're teaching them interviewing skills and empathy and things like that.
Okay. So talking about risking funding, federal funding. What kind of pushback have you had so far in your efforts to advocate for medical cannabis use? And is the receptiveness to your message impacted at all by race, do you find?
No, I may have not dealt with enough bigwigs to get the pushback.
Okay.
Most of the people that I'm speaking to seem to be very receptive to what I'm saying.
Okay.
I think if you have educated yourself and are fairly effective in communicating, that people will listen.
Okay. And it's not like, well, any particular race more open to the idea or less open to the idea in what you've seen?
No, I think I guess I need to think a little more about that. I think because we get into trouble so much, people of color, that we're more afraid of it. I think that's probably more, there's a little bit more fear on our side. And rightfully so.
Right. How different has your experience down this path been from your experience as an OBGYN in terms of being a Black woman? Has it been any different? And are there any similarities in these two paths?
I haven't, experienced a whole lot of negativity. I know that as a African-American female, I've had my share of battles in medicine. A lot of the attendings and people who run things in the hospitals tend to be white and old men. And I've got into a few battles with them, and I almost got kicked out of my residency program at Emory because I refused to do a C-section on a young lady who had just delivered her first twin. And the first twin came out, but the second twin was not coming out. No matter how long we pushed, maybe 30 minutes and nothing was happening. So I said, let's take her back to the labor room and give her and check and see, is she having adequate labor? Because sometimes the uterus can get a little tired, and that's one of the uses of cannabis. They used to give it to women who were not progressing in labor. And so, I checked, and she was not having adequate labor. So I decided to give her some Pitocin, which is a medicine that helps to make the contractions a little stronger. My attending came and said, why is this person still in labor? I'm still on our labor unit, I said, well, the second twin didn't come out and she wasn't really contracting. And she was like saying, take her back to do the C-section. Take her back to do a C-section. I said, she just wasn't contracting. If we let her continue to contract, she'll deliver. But, my attending left, came back, and I did not do it because I was like, I'm not going to cut this lady for no good reason. And she took her back and did the C-section anyway. And I was, heartbroken because I knew that lady did not need that surgery. And shortly after that, one of her attendings over her and me came and said that if you can't find another attending in this program to support what you just did, you're gonna have to find yourself another program. So I I wrote a letter to the department chairperson and told her why I did it, what I did, gave her the reasons why, and it was a very sound letter that was based on science. And that helped me to stay. And then there was an exam we had to take, and they said, you have to do very well in this exam or else you're going to still go. So I really had to fight to, I've had my share of fights as a result, I think, of being a woman. And even in private practice, sometimes we give more respect to white men who are our bosses than we do women of color. And even with patients, sometimes I've had to discharge them from the practice because they were rude to my staff. So I've had a lot of challenges as being a woman of color in medicine. I can't say thus far I've had similar issues in the cannabis space as of yet. So I don't look forward to any of that. But it seems to be a more welcoming space.
You think, being that it's about cannabis, but it's also it's new. You know what I mean? And I think as it gets to be more established, I would hope that those kinds of attitudes don't come along with it. But It's very interesting. There's a couple of things, because you say your attending was a woman, and it's interesting because I guess I would think that it would be the attending would be more inclined to not put a woman through that level of trauma. I expected you to say the attending was a man, but it's very interesting that I think you were even at that time approaching it more holistically than your attending was, which is fascinating. But I want to touch on how would cannabis help with that, because you said the contractions needed to increase, but I guess I kind of think of it being as a relaxer.
Exactly,
Almost.
and that I cannot answer. I can only say that historically, as I review physicians who have written down their experiences with a handful of patients that they work with here in America, a lot of this information was from the mid 1800s, 1840s, 1850s, where physicians were talking about what they gave the patient, and I think that's part of what needs to be worked out with the science and research to see how can that be. It's like for example, THC is kind of a biphasic chemical. Like at a low concentration, it can be sedating and comforting. At a higher dose, it can cause paranoia and anxiety. So it's like cannabis is a very complex plant, and because I've also seen it, the doctors in this country were using it to help people not miscarry, and then you read about people going to women healers to have an abortion using cannabis. So it's like it can abort and maintain pregnancy. It can help labor along, and after the baby comes out, it can reduce bleeding, and it's a complex plant that we need to. It would be wonderful if we could figure out how can that be.
It's wow. It's like two different ends of the spectrum and everything in between. That's amazing. So where would you like to see medical cannabis go in the future, and what role do you want to play in that?
I want to participate in research to see, what works with endometriosis, what works with fibroids, what works with menopause, what forms, what doses. I want to be part of that.
Cool. What would you like our community to know about medical cannabis?
It should be considered as not a last resort. Don't go through all these other things, pharmaceuticals that could hurt you and not give it a chance. It should be considered, I think, as part of healthcare, but at the same time, I guess I have to be reasonable and say, okay, it's illegal in many places, and so you don't want people to be criminals or get caught and be put in jail. But I guess I would want them to start voting for candidates who support it. I would like them to get involved and help advocate for its legalization. And if you can't work to advocate, then please donate to some of these nonprofits that are doing the work. That those are would be the two main things, and just for economic benefit and generational wealth. Educate yourselves, invest. There's a lot of money to be made, and in the stock market for those companies that have gone public, there's a lot of money to be made, and you could be helping your children and your grandchildren by leaving them something besides debt.
Yeah. And it's funny because you say about not wanting to leave cannabis as like a last resort thing, and it's a conversation I was having with one of my oldest friends, and her doctor had been trying to tell her for years, use medical cannabis for your MS, and she's left it until it was a last resort kind of thing, and it gets to this point where you're dealing with these long-term effects, and also this sense of hopelessness and the mental toll that it takes and all of that. And then, like I said, cannabis has been here, for a while, and you haven't used it. And so I'm just trying to get through to her, okay, we're at this point now. It is what it is. Let's try it, because nothing else is working.
Right.
So let's get on that. And I really hope that folks in our community start listening to that a little bit more. But Awesome advice about investing and donating to these groups, because there's some major groups and they don't have the pockets, the deep pockets that a lot of our bigger, more established organizations, civil rights organizations who aren't fighting this battle.
Right.
So they need that too.
And nor do they have the pockets of the pharmaceutical industry,
Right.
or the insurance industry. It's. I used to think that the NRA was really the bad dude on the block, but in 2000, when they are, 2017, they gave about, I think it was $5 million for lobbying to different Congress people and whatnot. But the pharmaceutical company, it was like over 200 million.
Right.
And
right.
They're not only giving it to our Congress people, they're also giving it to anti-cannabis prohibition groups as well. Yep. So there's a whole lot of money on the other side, and
yes.
We need to give our warriors on this side some help, if not with your blood, sweat, and tears, then with your dollars.
Yep, indeed.
And your vote.
Indeed. So what would you like Black women specifically to know about medical cannabis?
If they live in a legal state, definitely give it a try for some of the things that we've already discussed. And I know that when I was closing my practice, in the last few years up to me closing my practice, one of the three main problems that I would see with my patients was anxiety. It's like there's an explosion of anxiety, depression, and insomnia. And cannabis works very well for those things. And I would just encourage them to, look at that.
Yeah, one of the things I like is that we're getting more open to talking about this. I know that there's this kind of stigma that, therapy is, that's not Black. We don't do that kind of thing. And I think there's been a tide change about that it is okay to admit that you need help and start seeing people. And I think that, we've just kind of always been kind of dealing with it. And so I hope, like you said, that people start looking at this as a way of counteracting that, as just strictly a means of survival.
Yeah. I mean, I was very drawn to psychiatry. I really find it fascinating why people do what they do. But because of that taboo in the Black community, I said I would starve to death probably if I went to psychiatry. So I would go to OBGYN instead. But it turns out that I spent half of my time counseling people, because women just want to talk. They just want somebody to listen to them.
Yep, indeed. How can people follow up with you and what you'll be doing in the future?
The easiest way would be to go to my website, which is drfelecia.com, and doctor is spelled out, DOCTOR, Felecia, FELECIA, drfelecia.com. And if you want to do an educational consultation with me, you can make an appointment, and you can fill out the contact form, and it comes right to my email. Awesome.
Well, thank you. You've survived this round of questions. I really appreciate you joining and shedding so much light on so many things. I really hope that it helps to educate folks on the use of medical cannabis and how much impact it can have. I just really thank you for taking the time out to come talk to us.
Thank you for having me. I appreciate it. I've enjoyed it, and it's my pleasure.